Dozens of top officials in Washington, D.C., including some who have been near the president, have tested positive for COVID-19 over the last week. They include House Speaker Nancy Pelosi, Commerce Secretary Gina Raimondo, and Attorney General Merrick Garland. The vice president's communications director and the president's sister also contracted COVID-19, along with multiple members of Congress and staff members for the White House and National Security Council. The president of the Gridiron Club and Foundation has confirmed that at least 53 people tested positive for COVID-19 since the group's annual dinner last Saturday. Many of the D.C. officials who contracted the virus were at the event. All guests were required to show proof of vaccination, but did not need to provide a negative COVID-19 test or wear a mask. Joining us now for more on this is Dr. Jay Varma. He is the director of the Center for Pandemic Prevention and Response at Weill Cornell Medicine. Welcome, Dr. Varma. So we're now 2 years into this pandemic, actually beyond 2 years at this point, and we're now seeing this again, another outbreak, this time in Washington, D.C., among top government officials. Tell us, why is this happening now?
Yeah, unfortunately, much as we would all like the pandemic to be over, the virus operates on its own timeline and with its own behavior. And the lesson that we've learned, and by we, I mean we infectious disease specialists as well, is that this is a formidable opponent. It keeps finding ways to mutate and become more infectious. So until there gets to be a point where, the virus is no longer has any way to get more dangerous to other people, we're going to continue to be at risk and potentially have events similar to what you've seen at the Gridiron Club event.
So let's talk a little bit more about what we saw coming out of the Gridiron event, because as I mentioned, the guests they showed their proof of vaccination. They were not masked, or they were not required to be masked, and they were also not required to show proof of a negative COVID test. Do you think that in large gatherings like this, we should still have at least that testing requirement? Do you think that there are other protocols that we should be using, or we should just assume that this type of thing is going to happen?
Yeah, and this is really one of the most challenging points in the epidemic, because we're moving from this approach that was very collective, where, we had kind of standardized recommendations for any type of gathering, to one that's more nuanced and more individual dependent. And so I think the questions that people need to be asking themselves are, if you're going to be holding an event, first of all, what is the medical vulnerability of people? Is the group fully vaccinated? And by vaccinated, I mean 3 doses of the vaccine. That means the booster shot. Or are they, even if they are vaccinated boosters, are they at higher risk because they're of old age or have other severe medical conditions? That's one question. And the second question is, what is your threshold for safety? And in this situation, we're looking at an event where you have people who are, on average, a lot older than the regular population, so they're at high risk, even though they're fully vaccinated and boosted. And second of all, this is a group and very powerful people that you don't want to get sick. So I think if you're going to hold events like that, you need to be thinking about the same type of measures we were using earlier in the pandemic. That is testing, high-quality masks, and making sure you have really good ventilation in your facility.
And of course, we're talking about this in part because it is so many of those top government officials, but obviously the virus doesn't care who we are. And so this is something that could be happening across the country. And in fact, Dr. Anthony Fauci was warning that with the new subvariant that we're talking about, BA2, that there is going to be, in his prediction, another surge. What is the latest that we know about this particular subvariant?
Yeah, what we know about it so far are a couple of important findings. First of all, it's even more infectious than that first Omicron strain that we saw in December. And that's really important to recognize. And it's another reason for the humility of people like myself. That Omicron wave was the fastest spreading infectious disease epidemic I've ever dealt with. And I've worked on these diseases all over the world. So this one is even more transmissible. In other words, it gets to people faster. That's one thing. The second thing we've learned is that people who've gotten that extra booster dose, that third dose of vaccine, have very good protection against severe illness and death. You still have some protection with only 2 doses or that single J&J one, but it's not quite as strong. So that's why it's so important. And the third thing that we're starting to learn, although this is still preliminary, is that people who were infected during that big Omicron wave, that December, January period, probably have some measure of additional protection against this strain right now. I've seen it in my own friends and family, in fact, that, some of us like myself and wife who got infected in December, have so far been okay. But one of our daughters, for example, in college wasn't infected that first time around and now is, even though she has 3 doses of vaccine. So that's why we're really pushing so hard on the importance of this vaccination, is because it's really going to provide you the most durable protection. It won't stop you from getting cough and cold symptoms, maybe, but it's definitely going to prevent that severe illness.
You brought up cough and cold symptoms. It's worth noting that Attorney General Merrick Garland and House Speaker Nancy Pelosi both say that they are asymptomatic. It's interesting because the scuttlebutt on BA2 is that while it is so infectious, it does seem to be at least less severe in many cases. And combined with the fact that we have good vaccinations, we have protocols now if we choose to employ them, we have better ventilation, we have treatments. There are all these reasons now why people seem to be less concerned about getting COVID at this point. But are you urging concern for us? Should we be more concerned than we are right now? And then the other part of that is, when people are asymptomatic, do we know anything more about those other long-haul COVID symptoms, like fatigue, other muscle aches, other problems that may exist that might not be the sniffles and sneezes that we're thinking of when we're thinking about illness?
Yeah, no, it's an excellent point. So let me take the second part first and then go back to the first part. So, and that's important for you to emphasize, because it's something I should have mentioned before, is in addition to, there are really 2 things we think about when we think about preventing COVID. One is, can we prevent those severe illnesses, people needing to be in a hospital, getting severely ill, needing to be on a ventilator, and of course the worst, which is dying. That's one outcome. And the second is what we consider milder illness. But we know that term mild isn't really very accurate, right? Because there are a large number of people that can develop these symptoms that last for months, maybe even years. Obviously, we haven't followed people out. What we know so far is that vaccination does reduce that likelihood, but we're still learning how much that is and whether that's true for everybody. So you're absolutely correct that even if somebody has what's thought to be a milder illness, they may either get residual symptoms. The other danger people face is a silent one, which is a risk of blood vessel damage. So getting clots in your lungs, clots in your heart, clots in your legs. So that's one of the many reasons why it's important just to be careful overall. Now, getting back to the first question you raised, which is, what do we need to do right now? Should we be concerned? And the answer is yes, we absolutely should be. But we also have to recognize realistically, and this is the world I come in because I spent so many years working in government, is there doesn't appear to be much political will to go back to those business or school restrictions that existed in the past, which absolutely would bring cases down. And so I have to accept that fact. So what I've been really urging businesses and governments to do is to give people the tools to make sure they can be safe. So that means, you shouldn't have to bring your own high quality masks to work or a public place. They should just be there, just like we have soap, paper towels, and running water in every facility. Let's have masks there too. And just like we keep first aid kits in every facility, let's have test kits there as well too. And the third thing is, let's make sure we can improve our indoor ventilation. We can use filters and windows and upgrades to our system. So if we do all of those things, businesses and government together, we can get through this wave without the severity of illness and severity of infection that we're going to get if we don't do any of those things.
Really good discussion. Appreciate your perspective. Dr. Jay Varma, thank you.
Thank you very much.